Hi, I'm here in conversation with Dr. Sydney Brinson. I'm Allison Hart. Dr. Sydney Brinson is in the New York office, also licensed in Virginia. And we're here to just kind of talk about her practice. And I'd love to start off by asking you about your work and interest with the young adult population, emerging adulthood.
Yeah, it's a great question to kick off with. I think a large part of my interest in working with young adults comes from what my practices look like, from working in college counseling centers to kind of being in the heart of New York City. I'm always really passionate about working with clients who are going through big life transitions. And when I think about emerging adulthood, it is that. It's switching from college to a career, you're making new friends, maybe your dating scene is really kicking off. And so thinking about all of the different facets of life that are changing very quickly, it can be a source of beauty and it can also be a source of stress. And so a big part of my practice is how do we kind of work through life transitions, have someone feel like they're living a life worth living that aligns with their values. And emerging adulthood is certainly that.
Can you talk about how you understand substance use and mental health, specifically with the young adult population, and how you like to
Mhm.
work with it?
And something that I've noticed in my practice is that, especially in like the last decade or so, like mental health is such a conversation, but oftentimes substance use is a bit siloed and not talked about as much. I'm wondering, like, are drugs a way to manage stress? Are there times that you notice an unpleasant emotion and you see substance use being linked to that? And so there's a curiosity around like what role might this play in how you manage your emotions, how you manage difficult moments, and then also, like, what's the function, right? And sometimes it can be that stress management. Other times it's connecting socially with other people. And so there's kind of a range of ways that we can understand it as like a part of a larger picture. And whether we address it or not really depends on what comes up in the conversations.
When they bring that into treatment, it can often feel accusatory or judgmental. And taking
Definitely.
that stance of curiosity is such a welcoming way to bring in something that could feel really difficult to talk about.
Definitely. I think there's so many parts of therapy where shame, when we talk about like the function of emotions, shame often tells us to go inward, to hide. And I think bringing in a space that is curious and non-judgmental, it allows us to actually be just more open with ourselves about what our goals are and how things are going for us. So that's a big part of what I love about therapy is it gives us a space to do things differently.
I appreciate you bringing up shame. That's such a function of a lot of the work we do that isn't always clear. So when you can link that, I think you're already doing so
Yes.
much work before you're even doing any work on it.
Yes. Exactly.
Yeah. Okay. Dr. Brinson, can you tell me about radical genuineness? Because it's such an interesting concept, and I'd love to hear how that kind of gets factored into your work.
Yeah, it's like you read my mind. That's maybe one of my favorite parts of DBT. So for people who are listening who maybe don't know, DBT is a type of therapy. It stands for dialectical behavior therapy. It's kind of the bread and butter of what I like to do. And really it's founded on the relationship that you have with your therapist, as well as skill building that you can do in therapy. So a big part of DBT is how do we, manage stressful emotions? How do we communicate better with others? How are we more present in the moment? But a big part of that is like before you do any of that work, you have to have a relationship with your therapist that feels genuine and true.
Dr. Brinson, piggybacking off of DBT and radical genuineness, can you talk a bit more about acceptance and change as it relates to DBT and how you use it in your work?
Yes. So one of the kind of hallmark principles of DBT is that two things or two or more things that seem opposite can be true at the same time. And so oftentimes when I think about how that comes up in therapy, sometimes I have clients who are so thoughtful, they are high achievers, they're taking care of their family. And so I think a lot of times they're so focused on the change portion of like, I need to hit this goal, I want my life to look this way. And that's such a valid thing to come into therapy for. And at the same time, I often find myself kind of gently bringing in the question, like, how did we get to this place? And when I think about like even substance use, for an example, like oftentimes if someone is focused on the change component, I'm really working to bring in that counterbalance of how do we understand like what drinking is doing for you right now? Like what emotions are difficult or painful that might be leading to that. And so the more acceptance we have, the more we can be curious, and that gives us a little bit more leverage to do the change piece.
Question about cultural and socio-political stress as it shows up in the
Mm.
treatment room. I think that's a really topical question, and I'm very interested in how you deal with that, please.
For the clients that I have, it's really important for me to understand their values, their background, and then it's a part of my job to do work outside of therapy to understand like what is happening in a cultural context that I can bring in and ask about. Is really thinking through how do we honor maybe values around advocacy and social justice, and change, while also like not pulling so far where we burn out or we are, not taking care of ourselves.
Dr. Brinson, is there anything else you want to share today? Anything that we didn't touch that you think would be important for people to know about your work?
A part of me is just thinking about what it might be like for someone who hasn't engaged in therapy
Yeah.
before or has and didn't have the best experience and is considering going back. And, one of the things that I really appreciate about the therapy that I do is that we can have that curiosity together and that we can take it step by step. So for me, it means, maybe it's not even scheduling that first session yet. It's just having a call to get it on the books, right? And like, whether it's with myself or with someone else, like when you meet with a therapist, like open the door to talk about the concerns that you have. It can be ambivalence about treatment. It can be maybe not being sure that the fit is the best with the provider that you're talking to. But sometimes that's where you get the most information and the most data is when you can start to have that conversation about what might be getting in the way. And hopefully, I'm a chatty Cathy. I can certainly fill a space. And so oftentimes I think that that helps with clients coming in is the idea that like Sydney's going to be there and like there's a warmth there that can allow me to say some of the things that like maybe I have on my mind that I haven't said yet.